Our goal is your satisfaction. Let us show you the way.
Do you need antibiotics for dry socket? Does dry socket need antibiotics? Dry socket is not caused by bacteria, but by the loss of the blood clot that normally forms over the exposed bone in the extraction site. Antibiotics are only used to prevent infection after tooth removal in patients with compromised immune systems or who have a history of dry socket. Can you put Oragel on dry socket? Anbesol, Oragel, or oil of clove liquid can be dropped into the extraction socket for temporary relief and antimicrobial effects. Place a few drops into the socket several times a day as needed for pain and cover the area with a gauze pad for 10 minutes to hold the solution in the painful area. How severe is dry socket pain? Dry sockets become increasingly painful in the days after a tooth extraction. They may also have exposed bone or tissue, or an unpleasant smell. By comparison, normal healing sockets get less painful over time and do not cause any other symptoms. A dry socket can be very painful, but it is not usually serious. Is dry socket an emergency? A dry socket is considered an emergency, and most dentists will be willing to accommodate you after hours. If your provider does not offer emergency dentistry services, a hospital or urgent care clinic should be able to provide you prescription painkillers that can control the pain until your next appointment. How much does dry socket treatment cost? Because dry socket paste is not recommended for any other use, you cannot buy it from the drugstore. Fortunately, the application procedure is quite simple, and dentists charge little to nothing for the procedure. Ideally, you'll spend less than $100 on the entire process.
Take our lead. Let's help you make your mark.